At Sickle Cell Central, we believe that self-care and well-being are a shared responsibility between communities and services throughout social prescribing pathways. By harnessing the power of creativity, cultural messengers, and professional collaboration, we can deepen public understanding, strengthen trust, and improve the quality of cultural care. Our approach supports neighborhood research hubs for health equity that strengthen representation, communication, accountability, and assurance across services and community research ecosystems. Sickle Cell Central is a faith research network initiative.
Hello and welcome. I'm really pleased today we have Patrick Ojeer, who is the chair of the PPV group of the West London Coordinating Centre. Patrick, how are you?
Oh, thank you. Thank you for having me, Rudy. I'm well, thank you.
Good to see you again. So Patrick, we're going to talk about sickle cell. And of course, World Sickle Cell Day was held not long ago. So reflecting on this year's event, what progress has been made in improving awareness, early diagnosis, and access to quality care from your perspective?
Thank you for having me again. And I say hello to all who's listening, who will be listening. And I'm grateful that we got this time to talk about sickle cell stuff. And we talked about the World Sickle Cell Day, which was in 19th of June. I mean, I think June 2008, December, I think the UN passed a resolution to have World Sickle Cell Day from the following year, which was 2009, on the 19th of June. And henceforth, there's been a World Sickle Cell Day from that day on, you know. And it's really to make to bring awareness to this awful genetic condition, and also for all member states to help to promote and increase the services pertaining to those with sickle cell disease. And it's stuttering, but I think I was very excited of this year World Sickle Cell Day, because it was slightly different in as much as more impactful. I find we had a really good cross-section of people that spoke really, really well, and they share with us the improvements that they are engaging, or they are promoting, or they've been in part of, you know. And I think this particular year, as I said, I think the day was opened really by a really, really delightful lady, a Nigerian lady she's the first lady of Kwara State, and she was I think, ambassador professor of Falaki Abdulazak. And she really spoke well. And that was, again, different because she spoke about what she's trying to achieve in Nigeria. Now, we all know that sub-Saharan, especially Nigeria, is probably most populated people with sickle cell in the world. So to hear if she came and share with us what she's trying to do and what she achieved so far, and in about screening, which is a fundamental basic. You got to start from that. And she really explained to us and shared with us what she's doing regarding screening. And she wanted to do a newborn screening, and she wanted to implement in her state, right, newborn screening across. And I think if she could get really going and be very successful, I think other states in Nigeria would follow suit. And if they could do it in Nigeria, there's so many parts in Africa, sub-Sahara, which they'd be able to learn from. So that was different, because it spoke about some outside of England, but an important area when it comes to people with sickle cell and those who really, really suffer. That was good. You know, then we had, of course, in-house, which I mean, in England now, we had Dr. Stephen Okoli, who was heavily involved with sickle cell care. He's part of the co-founder of Imperial Sickle Cell Group and also Sickle Cell Alliance. He's also, you know, do a lot of research. One of the senior lecturers at Imperial, and he's done a lot of research in sickle cell. And also, I think, right, he's really keen to collaborate and share his knowledge. And that is, again, see that happening. is really good to hear and to hear what he's doing. He wasn't so district because there's so many things that he's involved in, because he'll allow other people to actually have their voice. And again, another person I was really interested to hear that day was from Professor Kenneth Charles. Now, he is from the University of West Indies, and he's, always from Trinidad. He really part of the University of West Indies, and talk about the importance of blood and the shortage of blood in the West, in the Caribbean, and something that he's willing, he's trying to change and make it better. Because again, one of the most important thing about people with sickle cell is our blood transfusion, which is so important. So hearing from his perspective as well, and the work he's doing, was really again another take of what's going on. And I think those things are really, really good. Apart from that, we also had what's happening here in England, especially West London, with the community program that's been rolled out on the West London HCC, which is Haemoglobin Coordinating Center, and see that sort of enhanced community sort of programs they have in place now, and that's just relatively new. So therefore, that's another improvement that you could see, and you could judge that. And the thing about this particular way this program in West London has developed, it's also highly dependent, or shall I say, highly data driven. So we really are going to collect a lot of data so we can learn from mistakes, and also if what we do is working. And that is also been really went down well for me, and we found other people were there as well. And we had a huge sort of very important sort of patient group, and they did some talk about experiences led by another wonderful sort of patient, or such a former patient, because now she's had a successful stem cell transplant, Zainab, which was again Garbasana. I mean, she has really been pushing for so many things, and be a great advocate. So to lead that and co-host that sort of group with other patients to tell us their experience of transplantation and other sort of areas of where the patient received and what they've experienced, and they share that with us. Again, you could see that. And again, of course, the like of yourself, you did a presentation yourself, Lori, which went down very well, because people think about their faith research network and they thought about religious people, but not knowing that it's far more about systems and how to enhance research, especially in communities, right? And that went down really well. So we had a cross section of very good presentations and also very good information, and I hope that we could build on that. And is in this way, I feel I was excited, because the only way we're going to get things done is about collaboration. Only way we're going to get things done be sustainable is for the patient to have their voice, and all those who are involved with the care to really, come and discuss jointly together what is what, and identify the gaps if there are any, and how best we could address those. So that to me was absolutely fantastic, and so it was a really great World Sickle Cell Day this year, and may next year to be even more. We look forward to that, because throughout the world, these things are going on, and now we need true collaboration, because we talk about screening, and we're talking about what Professor Abu Razak is doing in our state in Nigeria as the First Lady, and those two people we need, because those are people who actually could drive these things on. They're in a position to drive these things on, and we need that. But that's been happening also. The screening, I think, expansion is fundamental, and we're going to encourage that throughout. We are in collaboration with those in Tanzania and MOHAS, and they're really driving for improvements under Julie Makani, really driving for collaboration and reaching out to and willing to share the knowledge, and that's how we get things done. Because as I said, now there's, as I said, about screen expansion. I'm sure other places in Africa, they're going to try and start the screening program. We know about Uganda, we know about Nigeria, we know about Tanzania and Kenya. They are trying to do things. So therefore, these things are exciting to hear about. And we must really be part of that, And also, when you look in other ways, you're talking about going forward, especially when you look at how we could help each other in remote patients and so forth. We've got sort of electronic devices, and a mobile app. I think we could expand on those and make it more easy for those with in the front line of community care, and those are outside of the sort of hospitals and the sort of city centers.
And
All
of
right.
course,
So
and that is so important for, as the system changes to neighborhood health. And there's one of the three shifts is from hospital to community.
Absolutely.
And again, we've got to ensure that and that's why we talk about a shared responsibility for self-care and well-being, because the patient journey begins in the home, and every contact matters when it comes to your family and communities and carers. So we've got a great opportunity now to transform our own institutions, the faith, the voluntary, the community, the social enterprise. And of course, all of that is underpinned by collaboration, exactly as you say. And sickle cell, I think, really is the leading long-term condition when it comes to African and Caribbean communities in terms of needing to transform and improve the quality cultural care for those who need it.
Absolutely. Absolutely. I agree with that. As I said, I'm really driven by, again, collaboration, but collaboration got to have the patient at the center.
Absolutely.
Because, right, without that, it won't work, right? Because those are the ones who are affected. They got to have the center, and especially with sickle cell disease. Why? Because there's no two people that have, experienced the same from the illness. Everyone is slightly different. So it's even more complex than anything else. So you need to have that dialogue. We need the patient to have a voice, and you need to have patient leaders to able to who understand the system where they may not, to able to help them to navigate the system so that their voice is not heard, can make fundamental change in improvements. So therefore, they got to be in collaboration. They've got to be part of that. Whatever the conversation, wherever it takes place, they've got to be in a part of that. And that is the thing that my role makes mainly, because or else there won't be. And so we got to look forward. Apart from the mobile app, you got India now. If India get involved with this as well, in as much as, because I do believe there's a large population of people with sickle cell in India, which is not being recognized really yet. But having a mobile app, having a screening program in place, we'll all see what is what, and we all cater for what the needs are.
And what is good about that as well, though, Patrick, is that, again, one of the three shifts is analog to digital.
Yeah.
So again, the more apps that we get, the more creatives who get involved in improving the way the apps work, collecting data, as you said, providing information, advice, and guidance real time.
Mm-hmm.
When people, need support, they've got access maybe to transport or to carers.
Mm-hmm.
That will make a huge difference, as you know, in relation to did not attend to their local hospital and what
Right.
that means,
Mm-hmm.
getting their medication, because if
Mm-hmm.
people are sick, the difficulty of going down to the community pharmacies, they may have young children, they have families still to support, all these things are so essential. So I think what is good now that all of this is opening up to people with sickle cell. And in the long run, it's going to help all people, because anyone with a long-term condition are going to benefit from being able to access this information, the way that the speed that we're seeing all this develop now.
Absolute speed. I mean, you talk about speed. I mean, you look at what's the current as available at the present time, stem cell transplantation and gene therapy. I think again essential and really great things that come on board. And I think really when you look at those, they are accurate. However, at the moment they are it's so pricey. It's very costly, but still it's cost effective.
Early stage. It's early stage.
It's early stage. So we got to keep on. We
Yeah.
got to keep on, shall I say, to have access to this, because that's the only way it's going to change and improve. We got to have access to make sure that it's something that's desperately needed, and we're going to maximize the use at the present time. Okay, and so therefore we got to have, we got to change. We got to ensure the infrastructure we have in England. Take for example, we could cater for that, and we be more effective. We ought to have more operations and intervention with these cured therapies. We've got to have more. So therefore, we maximize whatever there is to ensure that for today we're doing the best we can, and we leave for tomorrow, for better tomorrow. And that will really go, because really we need, again, to ensure that the policy, right? The policies really are beneficial to us. They work for us. The system, understand the system, how to navigate the system. I mean, this is really, really exciting time in many ways, because I mean, this year, take for example, WHO executive board have passed a resolution to reduce the burden of stroke through strengthening prevention, care, and rehabilitation. That is a powerful tool to have when the WHO recognizes that we could do more, and more needs to be done.
And as you say that, Patrick, advocacy is important. We know we have activists, but the advocacy, that all the three-dimensional system thinking. So could you just tell us a bit about the role of the PPV group that you chair, and...
Well, I think, thank you very much for going with that, because
it's mission and role.
In England, there's 10 specialist centers for people with sickle cell, right? And each center have a geographic area surrounding it. And with that geographic area could be one or more specialist hospitals, but the rest local hospitals. But the plan is, and how it works is that for the specialist hospital, really, to collaborate with all the other hospitals, specialists and non-hospitals, and see what care they provide and how best they could enhance that, how they could share their knowledge experience, how they could really improve overall the care for those in that geographic area.
Right. So what you're also saying is that there's collaboration within the care pathways themselves.
Absolutely. Absolutely.
Which has been very important.
Absolutely. And what the PPV group does, right? And unfortunately, it's the only center that got a PPV that is independently run. Okay. It's supported by the network, but it's independently run. And basically what we do, we monitor the service. Okay. And we get involved with all aspects of training, and any way we could help to improve the services. We monitor, and we part of the leading body for decision-making body, which is just the steering group. We represent on the steering group, and our voice are heard. And this has been going on since the inception of the HCC. Now, from my perspective and the group perspectives, is that when we started the meetings, the steering group meetings, generally an hour. Okay, when we started, we had a slot of 5-10 minutes, right? About 2, 3 years now, our slot is now at least 40 minutes. Sometimes it's 50 minutes.
Which is good because it does
No,
demonstrate the progression.
absolutely. And also, we now have a budget for the last 2, 3 years. We have a budget. So we hold our own events and been successful. Take, for example, we had last year, we had a milestone event, which was highly acclaimed and successful. And that was about, you see, there are so many people now living with sickle cell that's older than 50, older than 60.
Yeah, because at one time when we were growing up, there was a time limit, wasn't there?
Absolutely.
It was time limit.
The general. I didn't know when I started this. Was not many people over 30. Now there's so many people are over 60. Take for example, right? So we had a group because the traumatic experience that they experience younger, not knowing that they will never live to adulthood, and now they're at this ripe old age. It was something that shared and went on tremendously well. And also,
Patrick, if I could just say as well, just before we close, one thing I did also pick up from the World Sickle Cell Day event was the creativity, the arts and creative
absolutely.
side. And that was people involved in the creative industries, and their condition was not an issue. It was about their creativity, and there was some great work there as well.
Absolutely. As I said,
that.
Well, the thing is, one of the leading person that on the art side of creativity, that's got sickle cell herself. She's in her 60s, and she repeatedly said, well, she never thought she'd get to adulthood. And so therefore, she, from a young age, when she went to hospital so many times, picking a pen or pencil to sketch was her way of getting through certain trauma. Now, it becomes such a passion for her, and she's extremely good. So she helps others because of that, and so people on board that, and we support her wholeheartedly, right? And that is just a different aspect that helps with people going through what she went through and others, and that is good. The group as well, the PPV group, is really enhanced. We got open group that people join, and they ensure that it's a safe place. They could come with anything.
That's important. That safe space, people with the cultural understanding.
And we encourage people to have their voice because, as you know, Rudy, that we've been in this now for 30 odd years, right? The patient voice is valuable, and unfortunately the patient don't realize how valuable their voice is. So in the PPV group, encourage everybody to have a voice and really enhance the voice best way we can, because as I said, we've got a budget now that we hold 1 or 2 events a year, right? And that is, everybody look forward to that. By the way, this year events is on the 22nd of August, and you're invited to the opening, right, on 22nd. And anybody else who would like to join us at St. Anne's Church in Dean Street in Soho.
It's a great location. I think we were there in March.
Right. That's right. And so therefore, and this year the theme really is about crossroads, and that is about in-depth discussion about the curate theories, theories that's around, and also about what is in the pipeline, and it's for anybody and everybody to know how to access this. If they can, what's the criteria? Ask any other questions, and also there'll be patients.
Where would people get this information if somebody is interested in finding out more? Is there a website they can go to?
We have got a website, the West London HCC website. If the general website, only got a PPV group, our website as well. Yeah. So therefore they could access there, or just get in touch with us through the HCC PPV group in West London. Because that is again an event that people, and this themes really is what members decide what is important to discuss. And these are questions people have been asking us for a long time.
Right. Patrick, there's one final question for you. And let's look 10 years ahead. So in 10 years, what would you hope to see as it relates to people with sickle cell? What kind of improvements in 10 years ahead?
Well, I really would like, first and foremost, to see these hypercube units they have developed over the last couple of years. They're still in pilot.
Right.
And I really like them to really develop. That is, to me, would be a massive thing, because pain is one of the most important aspect with an issue with people with sickle cell, right? And the adherence to guidelines is ridiculously low. And so, number one, if these acute units really got enough funding, so that they don't have one or two beds, but many beds, take for example. I think I would like to
scale
see
up the provision of beds for those.
and areas to do that, right?
Yeah.
And that will be, to me, if that's going to be done. But also, I could see already a pipeline, like other areas in the world coming together more and more together. I think Tanzania Mohas is leading the way in many ways.
More research collaboration is important.
More collaboration, research, and also not them and us.
Yes.
Right? More collaboration in equal footing. We all equal experience, and not the healthcare professionals or providers in one corner, and we tell you what to do, and we know best than you. No, it's not that. We got whatever the issues. If the infrastructure need changing, let's go about changing it. If there's not funding there, how can we get around this? How we could do to work together? Because we all have our expertise. As a voice, there's nothing stronger than voice, and we've got to be encouraged to use that voice in a constructive way, I must admit, but must be encouraged to use that voice as a patient. That's what I'd like to see.
Thank you very much, Patrick, and look forward to seeing you again soon.
Okay, thank you very much. It's my pleasure. Thank you.
Bye.
Bye-bye. Bye-bye.